very, very warm welcome to everybody here. And I know all of us have been super excited for the BW Annual Healthcare Summit. And D-Day is there, and apna number aa gaya hai. And like Sir said, so starting today with a cheer and with a very exciting panel discussion to kick off things. And we have the gentleman seated next to me and Zoya on a virtual call as well. Zoya, are we audible?
Yes, audible.
She can hear us, right? Okay. Okay, great. Perfect. So lovely having everybody here. And initially, when we were discussing about the topic, and happened to have a couple of conversations with Smriti also on that, and I think we reached a conclusion that currently, when you look at healthcare and when you look at diagnostics, there is just so much noise and there is just so much happening. The one thing that we hardly get to discuss about is about how to make it more patient-centric, how to make it more value that is being given to the patient. And the conclusion that we came to, it is different kind of collaborations that you can have in the same care continuum, where at the end, the patient is the one who is actually getting benefited the most. So on that note, and without further ado, let us start today's session, which will aim to explore the transformative potential of the evolving relationship between diagnostic laboratories and doctors in India, focusing on aspects such as quality of care, patient centricity, and the utilization of technology. By delving into these areas, we seek to uncover opportunities for diagnostic labs to provide valuable insights, support clinicians, enhance healthcare data, and ultimately elevate the standard of patient care, and that's what really matters. So my first question is to Aakaar, and it's more about what you do day in and day out, and that is something that we all call as integrated care. And initially when we had pathology labs and radiology setups that were different, and slowly like people have started getting it under the same roof as well. What I feel is that a report is never a diagnosis until a doctor interprets it, correlates it, collaborates with the imaging side of it and the clinical history. Because I've seen reports that can mean something completely off, but then when you just take a simple history, you'll realize that, okay, this is not what it is. Like a very simple test. I'll give you an example. Like all of us do, it's a simple hormone test. It's called a prolactin. So just the other day, I had a young mother and she had gotten her teenage daughter tested for the female hormone panel, and the prolactin was through the roof. And we got a call and she was crying, and apparently she had Googled what a high prolactin is. And Google ne seedha bola brain tumor. So obviously you can understand the mother's anxiety. But then when I spoke to her and I took the history, apparently the phlebotomist had taken the sample of the girl when she was asleep and not even fully woken up. And prolactin is one hormone that is secreted the most when you're sleeping. So then I told her, relax, why don't you come by, give a sample during the day. And then she gave a sample, value was 15. And she was like, wow, Dr. Dang, how did you come to know? I was like, see, that's the difference between a brain tumor and discussing with the doctor. So you do this day in and day out, your insights, experience, and your comments.
So firstly, thank you BW Healthcare for having me here. Thank you Anurag sir and Harbinder sir. So one thing that my guide during my post-graduation days taught me was that I'm a radiologist by profession. So he taught me that you're not a radiologist only, you're a clinical radiologist. We need to understand the requirement of the patient, the symptoms that which the patient is suffering from, and to take a detailed evaluation so that you can comprehensively understand what needs to be done, what investigations need to be done for the patient. So I truly feel that although as Velumani sir emphasized that single speciality is also is a profitable way to go forward, but I feel that personalization in healthcare and me being a diagnostician with an organization with radiology, pathology, cardiology, neurology, as well as nuclear medicine of the highest standards. I feel that I can understand the needs of the patient at a very micro level. There's a patient who walks in with a fever under evaluation, probably fever since 20 days, and fever is not coming down. I know exactly what all investigations need to be done. A chest X-ray, an ultrasound, whole abdomen, along with a fever panel for a blood test. So I can exactly evaluate for the patient, and in case suppose I find a positive finding like a lymph node, I can go in and do an FNSE or an invasive procedure. So the patient walks out of the center with a complete holistic diagnosis. A patient does not have to go from door to door, multiple pricks, and does not have to visit his clinician multiple times. So it definitely helps the patient in a big way if the clinical radiologist or the diagnostician understands what the patient is suffering from. Even a lot of corporates who have these pre-employment checks as well as annual health checks, radiology is also forming a very important part of their these health checks. For example, the calcium scoring and ultrasound of the abdomen. The other day, we were doing an exam for a cabin crew, and there were many incidental findings like a stone in the gallbladder. So she was her flying was, she was not deemed fit for flying because these are medical emergencies. So radiology definitely forms a very important part in, in a patient's or a person's life. And also like many times we do ultrasounds. I specialize in doing fetal medicine ultrasounds, and we find these anomalies in the fetus. We go ahead with the fetal MRI and eventually do an amniocentesis. We speak to the clinician, convert it to an amniocentesis, do a microarray, and eventually we'll even go ahead with the fetal biopsies or fetal autopsies and the placental biopsies. So patient gets a whole one-stop shop solution to all their requirements. So it definitely helps the patient. Secondly, even for the clinician, it's very easy and convenient for the clinician if the proper diagnosis or the proper finding that we find can be communicated with the clinician. It becomes very easy for them as well. So I feel there's a big role and it's the need of the hour for the patient to have a comprehensive diagnostic solution all under one roof. Many times a radiologist, for a simple example, we find a coarse ecotexture in liver on doing an ultrasound. So if we just mention that the patient goes to his clinician, they might add few tests. We'll speak to the patients, to the clinician, and just add a fibroscan or a liver function test and evaluate the patient and make a complete diagnosis of a cirrhosis of liver. So we'll really fast track the disease process and the way in which the patient can be managed. And making the right diagnosis timely is essential in the course of the disease for the patient.
Thank you, Aakaar. Always very insightful thoughts. And I'll go on to my next question to Dileep ji. And so when we speak about research, and especially when I look at it from a pathologist or a lab perspective, there's one saying my late Dadaji used to say that a doctor is a doctor until he's a student. So that's why research in today's world is indispensable when you look at the larger picture. And my question to you would be about the synergy between a lab and data-driven decisions based on a lot of research. And sir, your thoughts on what collaborative frameworks, data sharing agreements, and research partnerships, more importantly, can be established to support clinical trials, studies, and the development of new diagnostic techniques or treatments?
Thanks for that great question. You know, if I think about a doctor and a patient, one thing that actually connects them always, you know, whenever I look at a picture, it's very fascinating for me. I grew up in a hospital compound, and till I went to college, I was in a hospital compound. I used to watch doctors treat patients. The connect between a patient and doctor has been always a stethoscope, which represents technology. Symbolically, and today if you look at it, the technology is playing such a huge role. And post-COVID, as Dr. Anurag mentioned about the advances and the innovations that are taking, which are going to make the world so different. The expectation that this will really transform to really give them the biggest of the tools to manage patient health, but there needs to be a lot more that need to happen. As a good thing that's happening is probably India is one country where this is more likely to happen with the NDHM, National Digital Health Mission, if you look at it. It is always very important for anyone to know. You also mentioned earlier about knowing exactly what is happening. Event of a particular test that is taken, like you talked about the hormone test, right? If you look at it, you may immediately make a decision that this is what it is. But if you understand the context, if you understand the history, then it's a totally different game. The ability of someone to know about the disease pattern and how it can be treated, or is it really need to be worried? Now that historic perspective is what is needed. And here is where I think the game of connecting the lab diagnostic centers, the patients, the doctors, technologists, industry, universities, the government plays such a huge role. To me, what is going to be a big differentiator is going to be about the verticalization of patient data. Once this is done, I think ability of any doctor to look at the patient and be more conclusive about what is likely to be a problem with that patient. You know, always, I know this is an example I always give about family doctor that we were all so fascinated about. Family doctor was one who was considered the best for that particular family because he knew history of the family. He knew what worked, what did not work, what is allergic, what is not allergic. And because of that, they were able to treat the patient better, despite not having the best of the technology tools. Now, the best of the technology tools are going to create that. Now, the first of the things that need to happen to make this work is how do we get the data that is coming from patient from wherever, whether it is lab diagnostics or any clinician in a hospital, in a village or a big city or anywhere, it should congregate to really create a vertical data that is available for patient to carry wherever he goes. Second, in terms of creating insights with this data, creating insight was considered some of the toughest challenge in the past. But there is definitely technology transformation that is happening presently across the world. All of you are now talking about generative AI. You know, this is one technology which moved from 1 million users to 100 million users within days. There's no other technology which has taken that fast a growth in terms of moving from 1 million to 100 million. It is something going to be a boon, but it can also be scary because the data needs to be absolutely right for it to make right judgment. Today, the data that is available in public domain can be of any nature. As all of you know, WhatsApp industry generates so much of fake data, and fake data can really lead to a lot of fake conclusions on many things. So how do you create these data, which is going to be the ground truth for any of the decision making? I think those will be the future ones which will really create some impactful solutions. Having the platforms which industry will come and work with the government in making sure the transportability of data from one industry to another industry, clinician to any other thing will become a game-changing thing. You know, I take the example of, clinicians become the nodal points of data creation as well as data insight users. A clinician, when he finds some impactful decision or a solution, needs to become an impactful input for other clinicians. It's like a Tesla car. You know, Tesla car, when it is taking a turn on one of the toughest terrain somewhere in any road, when it learns what it learns on that day, it gets, again fed to all other Tesla cars. And other Tesla cars, when they go through that terrain, they exactly behave after having learned from what the first Tesla did. I think for that to happen, the transformation has to happen through platforming, through connecting through multiple platforms across the world. And I'm pretty sure India is going to take a huge lead in this.
Thank you. Thank you. That's very interesting. And I think this topic, I am coming to Kabir next. And Kabir, thanks for being here. And again, your expertise and the world of AI and data analytics is something that I'd like to discuss with you in continuation with what we were discussing. And what do you think and how do you think integration of advanced technologies and data analytics empower this transformation of reaching towards personalized and patient-centric care that enables doctors to make more informed decisions and further elevate the care that they are giving to the patient?
Thanks, Arjun, and thanks, Anurag sir, Raghavendra sir, for having me. Great question, and I think Aakaar, Dileep sir put it so beautifully. I do believe that there will be one report that would be generated in the future, which would combine insights from imaging, from lab medicine, genomics, and of course clinical data. And there would be a specialty called integrated diagnostician, which we believe would be generating that one report, and that would be the focal point on which decisions would be made by the clinicians. And as Aakaar also said, the great work they are doing as a one-stop shop solution, I think that is the future. In terms of technology, while it sounds great, bringing together everything on one platform, operationally it's not as easy. There are ethical challenges, legal challenges. Patients are not always comfortable in sharing their or putting their data on the cloud, even though in today's day and age anything and everything is on Instagram, Facebook, but somehow that X-ray or MRI along with their lab data, they don't want it online. So we have to factor all of those concerns. In terms of technology, artificial intelligence will play a huge role in this. There is such huge amounts of data that is being generated. All of that will be collated through artificial intelligence to give insights into the whole personalized and predictive medicine space. So we do believe that treatments will be more and more targeted. Already there are enough and more examples of this. We believe even daily matters such as health checks should be personalized. Everyone has a different history, a different status, and therefore even simple things like health checks should be personalized using such technologies. And there are now technologies emerging which enable us to interact more frequently with the clinicians. I mean, as a radiology and now diagnostics group, we are constantly encouraging our radiologists and doctors to interact with the clinicians. We've seen, I mean, you don't really need a technology apart from a mobile phone or a landline to, interact with clinicians, and that we've seen has such huge impact on the quality of diagnosis that you're generating. And it really, not everything requires very fancy technology. It's just that will and the push that's needed. The other impact such things and such ethos has is that for the patients, they feel so comfortable the moment you tell them that, okay, everything is okay, I've spoken to your clinician. They are not then bothering you for that fast report or that urgent report. So that operationally reduces pressure on your radiologists or doctors as well. What also we are seeing is now more and more technologies are emerging which can, and again, fairly simple technologies that can enable me as a group to share the patient's images along with the reports on a single platform to the doctor. So using PACS, we have that advantage, at least in the world of radiology, that the images can be transferred to whosoever the patient consents. So we are seeing more and more adoption of that. Even in health checks with corporates, we are seeing corporates are pushing us to share the imaging results and the lab medicine results with their their empaneled doctor. So I mean, such simple technologies are also there which can do a lot of what we are talking about, and certainly this is one way in which we see more and more interaction with the clinicians. And finally, one reality that we are all realizing in our imaging world is that there is a lot of fantastic artificial intelligence work being done in the world of imaging. And as Aakaar might be experiencing it, young radiologists are not willing to work post 5 p.m. or 6 p.m. So in that 6 p.m. to 8 a.m. time period, when there is no radiologist, artificial intelligence will play a huge role, where the role of a radiologist might even be reduced, because if 80% of the diagnostics can be done by the AI technology, the doctor has the advantage of the clinical history and the status of the patient. So maybe Aakaar, we don't know if unless radiologists wake up to this reality, who knows that the clinicians might take up more and more of the radiology and imaging part. So there are enough and more technologies emerging that enable us to interact more frequently with the patients, interact more frequently with the clinicians to, ultimately give the best possible diagnosis for the patient.
Thank you, Kabir. Always a delight listening to you. But just to clarify, Aakaar works till 11 p.m. daily. So don't say he doesn't work after 6 p.m. And we are very hardworking young lab medicine specialists and radiologists. And so I completely agree. This collaboration that we are talking about, Kabir, also I think has to translate from the doctor to the patient. And the magic and the power of that history taking is phenomenal. It was only a few days back, this young boy presented to me. He's a national swimmer. And his mother was very concerned. He's been having some breathlessness. He's gone to ENTs, pediatrics, pulmonologists. No one can figure out what the issue is. But when I sat down, spoke to his mother, and as soon as she told me that, okay, he's a swimmer and all of that, the first thing I asked her was, have you gotten him tested for a mold allergy? And he tested a grade 5 allergy for Alternaria and Aspergillus, and now he's undergoing immune therapy. So that's only because I was chatty with the patient and the mother gave me that history. So that collaboration goes in an entire circle.
Absolutely, and you don't need any fancy technology to do that. It's just the will and the...
Absolutely,
and
the way you're driven to get answers.
So just a point to add to Kabir's point, that many radiologists or doctors feel that AI would eventually replace them. They have this insecurity. But I feel that AI with radiology or AI with doctors makes the best combination. And the radiologist, if I speak about imaging, if the AI, in future, I feel that AI can take out the negative or the normal cases, and the radiologist could spend more time in evaluating the positive cases. There can be specialized reporting for all the positive cases, proper grading can be done, and rather than spending time on reporting normal cases. So in that way, AI can be used in a very nice way in the future.
Absolutely. Triaging the cases in a country like India so that the radiologist can focus on the one that matters. So quickly going to Zoya for my next question. And Zoya, this is a small anecdote that was pre-COVID about 5-6 years back. And I had a patient in Delhi, and they had a very super specialized esoteric test that they were searching, and their US doctor had told them to do. And they came to us. I said, I'm sorry, we don't do this in-house. And then we checked all the labs in Delhi for him, and your enterprise code was the one that was doing it. And hats off, and the kind of system that you created and how you fostered these esoteric tests even close to 7-8 years back, or as far back as I can remember. I think that is something that is, again, the need of the hour in India. And when I look at the functional medicine space as well, in the US, there are so many tests, and the list is so long for the tests to be started up in India. And the most important is that we continue to foster that collaboration between labs in India and the West, so that the physicians here see the same reports, get acclimatized and understand what these functional medicine tests are, or these esoteric tests, or the genetic tests. And then slowly that awareness increases, and then we start performing them here, because that's more viable. So tell us a little bit about your journey when keeping in mind these esoteric testing and the specialized tests, the awareness that you see in the country and in the years to come.
It's awesome when you start with a tech challenge. Thank you, Arjun, for sharing that anecdote. It always warms my heart to hear about patients that were positively benefited by the work we did. And I must start by saying it is 10:25 p.m. where I'm at in the world. So Kabir, young professionals do work late, like Arjun was saying. So anyway, jokes apart, I
I'm not
think
talking about
I love what
founders
you said.
and next generation.
Are you saying I'm old?
Okay, that's a
Kidding. Jokes
separate
apart, I
conversation.
think.
Go on, please.
So I loved what you guys have said so far. I think first of all, what you said, Arjun, a report is truly not a report till it is correlated, or in your words, a brain tumor stays cancerous till you discuss it with a doctor. And I think what Kabir said, we will have one report in the future. I truly believe that. I think here is the problem that stops us from getting to that reality that all of you have envisioned so far. The fact is that all these modalities that we're talking about, especially when it comes to esoteric testing that you alluded to, that we are doing, Arjun, these are all developing in a very fragmented sort of silos. And what happens with that is that there is never an integrated view. So whilst over the last decade we've tried to build that at core, I can honestly say we failed like everybody else. And the reason is not because technology is bad or because it's not well designed. Actually, quite the contrary. I mean, if you look at the two big EHR providers, whether it's Cerner or Epic, they've been around for 50, 40 plus years. Yet, and the technology hasn't changed for any of them. What can we do that they've not done, right? Or what can we change that hasn't been changed so far? I don't believe anything can change as far as technology is concerned. I think the problem is context. Currently, the context is the provider. What do I mean by that? I mean, a patient goes to Max Hospital, goes to Narayana Health, goes to Core Diagnostics, goes to Dr. Dang's lab, and we all have information which is living in our systems, which is provider specific, it is provider context driven, and it is not patient specific. Now, what happens with that is that no system in the world, no matter how sophisticated, can find information that lives in such disparate forms and bring it together to create an integrated report, which is correlated with everything. So the problem is not that the tech is not there. The problem is that we need to transform the context behind the technology. Technically, this is feasible today. So that's a good news. And how do we do it? We need to essentially add a meta layer on top of all our systems, so all of us sitting in this room and outside, which is patient-centric, so which identifies with the patient. And this typically needs to be managed by a third party who is none of us, so a new player that only does that. And the ownership of that data continues to be with the patient or their family as it is today. Now, this sounds like moonshot, and in some ways it is, but here's a proposal. Can we just start by integrating pathology, radiology, and clinical notes? I mean, that's still possible. Now here's going to be what's going to come in the way. Us pathologists, and I don't mean me because I'm not a pathologist or a doctor, but I mean the team I represent, and some of the other radiologists grew up in a very different world. One grew up in a world where the technology was native digital, the other was native analog. Pathologists typically, don't quote me on this or do, okay, but pathologists are typically technophobic, whereas radiologists are typically techno-savvy. Now, so it's not so much about bringing the two modalities together, but it's about bringing two communities, two ways of thinking, and two cultures together, which is a whole different challenge. Like Dileep said, I think the most likely integrator of all of this is going to be the clinician, typically an oncologist, and the most likely path, if we take cancer as an example, is going to be a physical tumor board, can be done in other modalities as well. And the most likely non-human integrator, as I think Kabir said, is going to be AI, and typically in the context of a virtual tumor board. So I'm really excited about watching all of this pan out and working with you guys to make some of this real. I know, Arjun, you asked me more about my journey, but I always focus on the future. The past has been there, done that. What I'm more excited about, what we're going to build next as an industry. So focusing on that.
Thank you, Zoya. So agree with everything that you say, except for the fact that pathologists are technophobic. You will be very happy to know I'm binging the new season of Black Mirror right now. And technology is something that excites me and our team so much. And these futuristic innovations we are yet to figure out if it's the helping hand or the big bad wolf. But I think exciting times ahead, and thank you for your comments. So Raghavendra ji, my next question is to you. And so we've been talking a bit about technology today, and usually what I feel, and also during the pandemic, what I felt was that technology in a healthcare firm, especially in a country like India, to actually have everyone imbibe it, it is actually a challenge. It's like changing the wheel of a moving car, where your team needs to understand how it's going to add in the value chain. And what are your thoughts and comments on the current technologies, the way things are progressing, and how can these technologies be leveraged to foster collaboration and improve patient care?
Arjun, thank you so much, and thanks to Business World for this opportunity. I'll just go back to my research or application day. So I was working with GE for quite some time, and then I was leading the business for GE Healthcare, and then I moved on to the Empee. So this is exactly like 15 to 18 years back, all the piece that Dr. Anurag sir was mentioning, and this is what was envisioned those days. So we were talking about precision, we were talking about personalized, and we were also talking about the predictive nature of the diseases. So that's when the program called as Microarray Technology Access Program, which GE pioneered, was introduced in India. And there were 4 adapters of this technology, and this was, I mean, as we all know, when a technology comes from the Western world to the India, it's quite expensive. So there were 2 research institutes who have adapted this technology, which was CCMB, and then the other one was CDRI. 2 private institutes or private companies, one was Dr. Reddy's and then the other one was AstraZeneca. These were the 2 that have adapted these technologies, and then they started working on the microarray based precision, predictive and kind of thing. Now if you look at this, since the one of the drawbacks that technology had those days was, you know, what the speciality today we have, you know, there's so much of data that gets generated, data collation, data mining, and you know, getting a meaningful data out of that was very difficult. So this got shelved, and you don't see, there was a phase then nobody talked about it. Now over last couple of, you know, I would say, you know, I wouldn't say a couple of years, but then few months or at least about like 12, 13 months, you've seen that there is a huge rush towards the you know, the precision side of it, or you know, the genomics has taken over. So you see the genomics, the similar thing, instead of a microarray, if it becomes through genomics, because the genomics, you know, the sequencing of the you know, whatever you want to sequence has become very economical, and that's how the things are moving. Now if you see, going forward, these 3 things will become very, you'll be hearing a lot about precision, personalized and predictive. And I'll give you some of the examples where, you know, we are working on. For example, the company that I work for, today we've brought in the precision of a PCR and a readable format of a rapid on a TB diagnosis, which is you know, MTB, and you have the rifampicin and as well as the isoniazid on it. So it's more like a POC, you know, point of care kind of a thing. You know, that's where we say a clinician on the spot can actually look at it, and then, you know, you can start you know, prescribing the medicines, because he knows he's positive, he knows he's resistant to so-and-so drug, and then those drug doesn't work, he would move on. Now look at the collaboration here. The collaboration is you're bringing in the precision of a PCR and more a personalized treatment there, right? You're actually giving him you know, a drug which he's not resistant to. That's on one side. Now look at the power of the genomics that today it's bringing in. I'll quote a few of the examples what we have been doing in one of our companies, where, you know, the phenotypic outcome, or, you know, from a clinician standpoint, when someone does a blood test for a diabetes, you know, anything above 160 is treated as, you know, we all know he's with diabetes. There are 2 patients who come with the same report to the same doctor. Now, how will he differentiate what is the underlying cause of the diabetes? Because if there is a mutation in HNF4, this gentleman, so I'll give the other example. If there's a mutation in GCK gene, this gentleman wouldn't need any medicine at all. He just needs a diet control. If there is a mutation in KCNH2 gene, this gentleman would need only insulin. No other drug would work on him. Now, a diabetologist, how would he differentiate when someone comes with a report which says, above 160. He's diabetic, right? But that is exactly what the precision is and the personalized treatment is all about, right? And that's what the technology is going to be. And similarly, there are a lot of examples. So for example, from you see a similar kind of a thing for the heart diseases as well. If there's a mutation in one of these, then you don't need this, but you can actually use these drugs. From a predictive standpoint, so you are bringing in a precision of the precision in the diagnosis, leading to the personalized treatment. So a particular patient where there is this particular mutation, he wouldn't need any treatment at all. He just needs a diet control, right? And how many of us know that, right? As soon as you go to the diabetologist with a 160 or 170, he will start prescribing the medicines. And obviously today, most of the panel members were speaking, it's young generation who are very, very, especially the clinicians understand, all the data-driven kind of an approaches. And they are very eager to know these kind of things because this is what the underlying reason is. If you're just going by the causes or the effect, they're not going by the effect. They're actually looking at the causes of it. Now, this is how it is going to be, and this is what's going to be the future. And if there is a collaboration between the patient, the clinician, and the data that comes out, I think the beneficiary is the patient, right? He doesn't have to go through the medicine story, or he doesn't have to go through these things. And similarly, from a prediction standpoint, and we have a case where we've done a whole genome sequence for a particular, and this gentleman happens to be a film star, top film star, and we have done the whole genome sequence for him. And what we have found is, we have found a mutation in KRAS gene. This means that this gentleman will definitely have colorectal cancer. And then we've suggested him, why can't he do a simple colonoscopy and then get that biopsy? And to our prediction, this gentleman was in a very, very, very early stage of the cancer, the colorectal cancer. And now imagine, we always say, right, when a patient comes to a doctor saying, if he had come at a stage 2 or stage 1, the treatment of that patient would have been better. But now I'm saying that I'm coming at a 0 stage, that this gentleman is definitely going to have a particular cancer in future. Change the lifestyle, change the diet pattern, change the stress levels. I think that is what the world is going to move. And when we talk about the longevity, and that's the buzzword these days, and some of these things are definitely going to play a very role, whether it is a nutrigenomics, whether it is a pharmacogenomics, or some of these things. So when you put all these things together and you get a very meaningful data, and of course regulatory certified data. I would say there's a lot of data that is available, and that data gets generated. But then how meaningful this data is and how regulatory this is approved for a particular thing is what we have to look at. So all in all, I would say if the collaboration is from the diagnostic side, and then the conversations Arjun, you were talking about the conversations that you had with the patients for getting more and more insights from the patients. And then look at from a clinician standpoint. So if you bring in the collaboration between all these things, ultimately the patient outcome is going to be phenomenal, and the experience of the patient is going to be one of the best. And as a doctors, what gives you happiness is if you're able to save that patient from a particular thing, or your treatment is going to have a long-lasting effect, is what as doctors you would have learned. And as a researcher, I would say, if you're able to bring in these kind of things, and if you're able to bring in that, the effect of these on this 1.3 billion population, and I think, we have done our job, Arjun and the panel. Thank you.
Thank you, Raghavendra ji. So great words, and I think we are at the end of time for the session. And I just have one quick word, not a line, word from all the panel discussions about what your advice to the future diagnostics or healthcare leaders, what would that one word be that they should imbibe in their daily work? It can be something like technology, it can be something like training, education, awareness. You can only say one word because the organizers told me strictly to finish on time. So let's quickly start this rapid fire and then we'll end it.
I feel come what may, patient has to be the priority. Patient is the priority.
I actually had thought of just saying patient, so I will not say more than that, but it has to be the patient.
I'll say training.
And I would say cost for a country like India. If there's cost, I go back to what sir was telling, scale nahi to kale nahi. So cost comes in for a country like India, 1.3 billion population. If it is affordable, scale automatically builds and enterprises will survive.
And Zoya? Zoya, anything from your side on this? I think I'm not audible. Okay, that's fine. So since today is the day of punchlines, and like Sir said, scale nahi to khel nahi, I made this punchline sitting here in my head. When the time is less, the panel discussion is a success. So thank you so much. Thank you so much for this wonderful start to this fantastic day with this scintillating panel discussion that we've had. And tali ki awaaz nahi aayi yaar. A big round of applause to all the panelists, the wonderful audience, and obviously the amazing organizers in business world for having us. Thank you so much.